We had Lane Johnson on the show about a week or so ago. He talked about his injury. I want to ask Dr. Jeremy Boyd about that. We had an injury last night in the Phillies game that I want more information on, plus Brandon Brooks and his injury. And that's from my guys over at Trifecta Therapeutics, the premier sports rehab performance center in South Jersey. If you can hear my voice, you can get to Glassboro. If you're tired of being in pain, you know it's nice outside, you're playing basketball in the driveway, you might start throwing that baseball around with your son, and you know what? Your arm doesn't feel as good, or your ankle hurts, or your knees start to bother you. Well, you can check the guys out at Trifecta Therapeutics, and they can tell you whether it's just something minor or something that you need to take a further look at. Weekend warrior, finely tuned athlete. Trifecta helps the pros and the Joes. So, don't settle for less. Check out Trifecta Therapeutics to schedule your free discovery session right now. Use code ESPN Radio at trifectatherapeutics.com or call today. All right, so let's take a look and unpack some of these injury situations that are going on, and we'll bring Dr. Jeremy Boyd into the conversation for that, and he joined us on the Boardwalk Honda Hotline. Doc, welcome back, man. How you doing?
Not too bad. Having a good old time. How you doing?
All is well. Now, we're in the off season here, but a lot of news with the Eagles came out today, which kind of got me thinking when I saw that they were going to be speaking. I said, I want to get a little update on what we think could be happening here with some of these guys. Now, Lane Johnson was on with me about 2 weeks ago. He said he has been cleared. Now, he is 4 months removed from December surgery, but he had some interesting problems with that. He had that tightrope surgery. So if you can kind of give our listeners a little insight on what that kind of means, that sidelined him for 4 to 5 months. He had the surgery back in November, late November, like November 27th. So would that surgery tell you that he should be good and ready? Because people are saying, well, he's old. He can't stay healthy. So what do you think when you see a guy, 30 years old, who's had that ankle surgery?
Yeah. So, I mean, obviously with the age factor, it's going to be, and his position of line, it's going to be a little bit more of a challenging factor, but he seems ready to go, from what he spoke with you about things a couple weeks ago. That tightrope fixation surgery, it's for these high ankle sprains and, just to kind of tighten things up. It's exactly how it sounds in a sense. So after these sprains, pretty much there's a connection between your two shin bones, your tibia and your fibula. And when they keep reoccurring or we keep getting some injuries to them, it kind of loosens up. So it makes it easier and easier to potentially have these type of injuries. So this tightrope procedure, it kind of tightens it down so it doesn't keep taking the athlete out of the game. So it is more of an aggressive procedure. Your foot, ankle surgeries take a little bit longer due to how far your ankle is essentially from your heart. So healing timelines are a little bit lengthened. But, if he puts in all the good work, they get all the range of motion, it's good that I believe it happened again, November 27th or so. So, he's a couple months out. He has a couple months to go. It is, hopefully he can come back from that. It sounds like he is.
Well, this is what he said. This was about 2 weeks ago when he was with us. He said it was a tightrope procedure in the beginning, but I needed a deltoid repair, which is the inside ligament of your ankle. Mm-hmm. He said that was torn. He tried playing on it as much as he could, and he got the surgery on December the 7th. So that deltoid repair, the inside ligament, that was torn. So what is that a red flag?
Yeah, I mean, being that the deltoid ligament, that would be what we call a medial ankle sprain, which is super rare. Most individuals were have a good understanding of a lateral ankle sprain or just rolling your ankle really bad. To have enough force to sprain and then further tear the deltoid ligament, that's one of the strongest ligaments in your body. It's a group of 3 ligaments, so that's why it's a deltoid and everything like that. That's a little bit more serious of a procedure, and that's going to take some more time to recover. So it's just more complicated all over the place. And now you have back-to-back procedures kind of lined up, and it'll take more time to recover. But again, these guys are the warrior mentalities, are for good rehabilitation, good docs and everything like that. They, hopefully he makes a full recovery.
Now, if I say to you, hey, he had those two and you're, treating him, would you be, I don't know that he's making it through a 16-game season recovering from that, or if he's recovered, the re-injury factor should not be there?
I believe, for just about, most things, unfortunately, especially these more advanced procedures for orthopedic surgeries, there's always going to be a slight increased risk of any injury. And we got to look also beyond things to the knee, to the hip, especially with the ankle. So when we see the limitations in the ankle, just let's say from scar tissue from the surgery, there's now probably prolonged periods both times where he's been in a boot or a cast. I know the specifics of those sort of things. That's going to lead to some limitations in motion. And we can see some, compensations are making up at the knee and some other areas. So I wouldn't be surprised if he doesn't kind of come back to full form. We just noticed with any of our sports statistics, the likelihood of lost time in games or missed games and seasons after major orthopedic procedures, ACLs, Achilles tendons, it kind of goes up. So hopefully he can push through for a whole season, but with his age and the multiple procedures, I would think that he may lose some time here and there.
All right. One more real quick I want to get in is Brandon Brooks, who had the Achilles injury for the second time. This is the second time he's done this, but he did practice last year. December 30th, he was practicing. He did not play. He got injured before the season started. He's 31 years old, has 2 Achilles tear. But, man, I don't know if you've seen him. He's in tremendous shape. But when you hear a guy with a torn left Achilles, and he had a torn Achilles, I believe, his right Achilles before the 2018 season, at 31 years old, what's your take on his ability to stay healthy with those 2 injuries?
Yeah, and now it's, I believe, his left for this time around. So I haven't seen him. I haven't got to, I was trying to look and see any videos of him or anything like that. They're kind of restricted here and there. But the fact that he's out there, he seems like he's moving pretty good. That's always a great sign. Achilles tendon reoccurrences, once they kind of anchor them down, the likelihood of, injuries to that Achilles seem to be less than compared, let's say, our ACLs, where the re-injury rate seems to be a lot higher, just due to the fixation of how they anchor that Achilles tendon up. They kind of stick it down there, they screw it in, and it seems pretty secure for most individuals. But you do see a lot of these Achilles tendon repairs because it's such a long rehab, and it's a prolonged period in a boot where, again, these kind of compensations happen. Like, look at both Kevin Durant. He's kind of going through some issues into some other areas. We have a couple other basketball players who also same thing, where they recovered from their Achilles, but now they got a couple things like hamstring strains or actually ACL injuries. So that wouldn't surprise me that, especially how difficult his position is.
All right. One last quickie on last night. We had the injury to Jean Segura. He got placed on the injured list today with a quad strain. I know those things are tricky, but those things, right quad strain, he's another older guy, 31 years old. Is that a 10-day injury? Is that something that lingers a little longer?
Yeah, it really depends on the grade. I think he did go for an MRI, so that's showing that it's not, just your latest, he just a quick little strain. If it is a grade 1, so that's our lightest of grades, he can be back within a 2-week time frame. He starts getting into a grade 2, which is that kind of medium level of strains. We can be thinking of around the 1-month marker to 6 weeks. So usually, when you have the big bad wolf, which is a grade 3, we know you're out for a while for that. So probably anywhere from that 2 to 4 week marker. Some times people fall in between grades. So hopefully it's more on that grade 1, just kind of strain it, let the things back up, get back in the game.
Yeah, he's Dr. Jeremy Boyd from Trifecta Therapeutics. There you go. We broke down a couple of the key injuries that are happening locally. Lane Johnson, that's one to keep an eye on with that ankle injury, that deltoid ligament there. So, Doctor, we appreciate, of course, always filling our listeners in on some of the key injuries there. That Segura stuff will be interesting. I didn't see the grade, but I know he's certainly out, and we appreciate your time, man.
Thank you. Thank you for having me on.
Absolutely. Dr. Jeremy Boyd, Trifecta Therapeutics.